Welcome viewers to another informative session of the Health Info Africa show. My name is Kwame Afosa, and as usual, we have experts with us to take us through today's discussions, and you get to know them as time goes by. So we'll begin today's show by, as usual, giving you updates on what's going on with the vaccines, and then we'll also talk about the COVID-19 strains that are emerging. Now, these are really important issues that need to be talked about. So we have information for you on these particular issues. The next thing we'll go on to talk about has to do with the media coverage of COVID-19 in Ghana. As you can see, there appears to be the case that people are not observing all the COVID-19 protocols. And the question we want to ask is, what is the media doing about this? What role is the media playing in informing the citizenry on the dangers of COVID-19? We'll then go on to talk about another important session, which is continuation of a discussion we started last week on telemedicine. And we have with us an expert who's going to tell us about how we can use telemedicine for preventative healthcare. As I indicated, it's going to be another informative session. There's a lot for us to talk about. There's a lot for you to learn. And as usual, we're waiting for you to send in your comments and questions. We're ready for everything. So, help us and then like the feed, share the feed, let it reach a lot of people so we can keep the good work going. At this point, I'd like to bring in my co-host, Dr. Edward Ofori, to help us, welcome you guys and then give you a gist of what we have for you today.
Hi, Kwame. Yes. So I'd like to thank you and everyone that has tuned in at this time to listen to our show. My name is Edward Ofori. I'm going to be the co-host for this particular show. In fact, we have a lot of things for you. We've been doing a lot of work behind the scenes. When you visit our page, Health Info Africa, you will find a lot of good things that we've done. And then please go there and like us on YouTube, Instagram. You're all on over the social media. We've put in a lot of work. So please make sure that you tune in every Saturday to listen to our live feed. And also after that, we do have a lot of our videos on our page. I want you to like that. Today is definitely information packed. You're going to learn a lot. There are so many things that we're going to learn at the end of the day, but most important thing is that we should keep ourselves safe and keep everybody healthy going forward, especially against COVID-19. So again, I'll turn on back to Daniel, but before I do that, we're going to take a little short break. And after that, I would like for you to sit back and relax and enjoy the show. Share the feed one more time, keep sharing it so that more people will benefit from it as we go forward. So like I mentioned, we're going to go on a short commercial break. And as soon as we come back, we will continue the show.
Welcome back, viewers. And as I indicated, we're going to take you through the COVID-19 vaccines, as in what is going on with the COVID-19 vaccines currently. So,
all right. So I think Daniel has some technical difficulty. We're going to pick up the show from there. He will give us, when we reconnect with him, he's going to give us an update on the vaccines. The various strains will be presented by myself. We're going to talk more about, what we need to do to prevent ourselves from actually. All right. So again, I think Daniel is having some issues over there, but we're going to continue the show going forward. We will bring him back to talk about the updates on the various vaccines. And from there, we're going to talk about, like I said, I also took the vaccine just some few days ago, and we're going to share the video of me taking it and things like that. We also will share the side effects that a lot of people have reported whilst taking the vaccine. And then I will go ahead and talk about the various strains that we identified that are gaining a lot of grounds when it comes to the spread of the virus. And like he mentioned, we have a very knowledgeable assistant professor with us and also a nurse practitioner who are going to help us today have a discussion on the various aspects of media coverage and how telemedicine comes in post-COVID and so forth and so on. So without much ado, we're going to take a little bit commercial break, and then when we get back, Daniel is going to give us the update on COVID.
All right, welcome back, viewers. So at this point, I want to take you through what is going on the COVID-19 vaccine front. So I'm sure you might have heard there's actually some really good news on the COVID-19 vaccine front in that many vaccines are getting approval. Now, as you can see from the slide that I'm showing right now, we have 3 vaccines that have been approved for full use, and then we have a number of them that have gained approval for early use or emergency use. Now, this is exciting in that the numbers are increasing. And as the studies keep going on, you're going to see them moving more towards the approved section. So it's good information for all of us because this tells us that soon or in the near future, it gives us hope that we're going to get some of these vaccines for use in Ghana. So as I indicated, there are about 64 vaccines in the clinical trial, and about 20 or more than that have moved into the advanced clinical trial stages. So this is really exciting, like I'm saying. Now, the next thing I want to talk about has to do with the number of countries that have actually started, their vaccination, programs. So last week, we had only about 10 million people that had been vaccinated worldwide. Now, the number has almost doubled. It's almost 20 million people who have been vaccinated as yet. The United States, it's leading with almost 6 million. Again, they are behind their target of 20 million by the end of the year, but they are they are catching up. China is behind, and as you can see, other countries are also, making progress in vaccinating their citizens. So again, this is really good news. Hopefully, with us in Africa, we'll start getting some of these vaccines for use soon. Now, one thing I'd want to do is to admonish our viewers that you should not pay attention to the conspiracy theories that are making rounds about these vaccines. These vaccines have been fully vetted. The ones that have been approved have been fully vetted, and they are really, good for us to use. I'd want to, let you know that Edward actually got vaccinated last week, Wednesday, and he's here with us. Everything is fine. I personally know other people who have been vaccinated, and they're all doing good. So this is a video of Edward taking a shot earlier this week, and he got the Pfizer vaccine. So this is not a made up video. You can actually see him over there taking the shot. And as I indicated to you the last time, the side effects that are associated with the vaccines are not different from what you typically get with your flu shot, and they last for about a few days. These include pain at the site of injection, swelling, maybe some minor aches and fever. So it's really, nothing to be worried about. These vaccines have been well tested. It's not going to mutate your DNA or affect you, as some people have talked about. So this is what I have for you on the vaccine front. I'd want to switch over to Edward to tell us about the emerging strains of COVID-19, the updates that are available on those ones.
All right, so thank you very much for that important, very, very important information when it comes to COVID-19. The number of people who are getting vaccinated is great, even though in the United States we're still struggling with rollouts. But we have a very good optimism that going forward, everybody will one day get a vaccine or have some sort of protection, even though there's a lot of pushback we're going to get that. So moving forward, we're going to focus on the new emerging strains of the virus that are making a lot of, news waves. A lot of people are talking about these. CNN is featuring it. Everybody's talking about the new strains and what comes with it. But then the good news is that at least there's preliminary studies that have shown that at least the Pfizer vaccine appears to neutralize the key mutation of the COVID variant found in the UK and South Africa. So what are the variants that are found so far? There's a lot of them that have been discovered, but the interesting thing is that I'm going to take a little time to explain what these mutations mean. So viruses, in order to keep, multiplying in our bodies and things like that, are prone to mutations, which means changes in how their genetic makeup is. And these changes sometimes doesn't affect how the virus functions. And sometimes it does affect how they're able to replicate or multiply. And when that happens, it actually increases the spread, the transmission of that particular virus. So since COVID-19 started, there's been so many strains that have been kind of picked up by surveillance. And what happens is that some of these strains, again, like I mentioned, is not propagated. Maybe it will end up in a very few people and doesn't carry on to the next group of people, and therefore the multiplication kind of halts. And because of that, that particular variant doesn't become predominant. However, in September 2020, there was, some interesting thing going on in the southeastern part of UK, and they realized that about 60% of the people who were coming to the hospital were having a strain which was different from what we already know in circulation. And that strain, they titled it as B1.1.7. Pretty much it's a mutation. There's several changes in the virus genome, but there's a very key important one that is happening on the spike protein. Remember, the spike protein is the protein that our vaccines are designed to kind of produce antibodies against. So this became very concerning to epidemiologists and infectious disease experts. So far, we've identified this has spread to a lot of places, including Canada and the United States. And I strongly believe that even though we said there's none in Ghana, we should increase our surveillance when it comes to sequencing of these viruses from people that have contracted the disease, or even voluntary people. Also, we found that there's another strain that has come up in South Africa that is also concerning, because it is also found on the spike protein as well. It shares very close similarity to the one that was found in England. And so far, we realized that there's a particular deletion which is missing, which is the 6970 deletion, which is not present in the one from UK. So looking at these two, one thing that the CDC is saying is at this point is that there is no evidence to suggest that the variant has any impact on the severity of the disease or even the vaccine efficacy. So what do we mean by that? So pretty much what it did was that they picked the people that have already vaccinated, especially taking the Pfizer vaccine like myself, the expectation that they've developed some sort of immunity or antibodies against the spike protein of the coronavirus, and then they will design some sort of mutation that mimics the one that we see from South Africa or UK. And what they will do is they will test to see if the antibodies were able to neutralize this particular strain of the virus. The good news is that, and like I shared earlier on, is that yes, it's been shown that that one from Pfizer has demonstrated some neutralizing effects on the variants that we found from the UK and South Africa. It doesn't necessarily mean that we shouldn't worry at this point. There has to be more studies that has to be done. But from the surface, it looks like the vaccine will probably cover some of these strains. We are not certain for sure. More studies will have to be done on that. So with that, I would say that I'll end the story on the strains. We'll keep you guys updated on what we expect from here on.
Yeah, so there you have it from Edward. So the expectation is that we'll continue to protect ourselves because we know that these strains spread faster than the previous strains that we're aware of. Protect ourselves, continue to mask up, wash your hands, use the hand sanitizer, avoid crowded places. I mean, let's all play our part in preventing the spread of COVID-19. As Edward indicated, the more the virus, spreads, the more we get these mutations. So let's try and curb all these. Now, at this point, I'd want us to take a quick, break. And then when we come back, we'll move on to the next discussion, which is to talk about how the media has covered COVID-19 in Ghana. What role are they playing? What role, should they be playing? In what ways, are they contributing to the narrative in Ghana?
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shark is inside now. I'm at to say it's on link copy. But
Tompo, 11 p.m.
Oh, if it comes a seed in the who give me, I guess some entanglement before that side.
You know they hear social distancing, eh?
To leap from D, some crowd, the whole. As I be young in the Emmas are they cool. If you no go pick me to catch them in small lifts.
See, this be the problem. Who tell you say corona affects youngins? If you know they care about your life, if a guy say any over 50 years, away get hypertension, way poppy to be diabetic. Charlie them their cold mess them up.
You are go wear face shield.
And that changes anything? That thing they protect only your eyes.
Plus face mask.
Charlie, the youth will take this thing for granted. It may not kill you, but if it give you long-term damage to vital organs like your lungs, if you go get for outside cargo house, they give your OGs where them die, will you be able to fend for yourself?
Chama, so I can't say because unless I start, they do Yahoo, I enter Benino, na phone cost me this the COVID said make it left one at talk. Who?
If people know they follow simple directions like social distancing, hand washing, wearing face mask and things, the COVID no go anywhere. And the way they make careless there, it be like you no go left with anytime soon.
So to lazy my shadow make beans in.
If you love yourself and the people around you, they house and take your shadow go back cry.
You are here, you more like dog me. So they kill my vibe cry. Make a go play my FIFA.
And keep fighting with positivity.
All right, so there you have it. Continue to observe the safety protocol. Even if you are young, even if you feel you're going to survive it, think about your endosewa at home. Think about your grandfather at home who may not be able to survive COVID-19. And let's all protect ourselves. Now, as I said, we're going to move into the next part, which is a very important discussion. And then we'll be talking about the media coverage of COVID-19. We have a communications expert with us, Dr. Kote Nikoi, who's going to tell us about, the coverage, explain the media landscape, and then talk about how the Ghanaian media has covered COVID-19. He has critically followed the COVID-19 discussion in Ghana, and then we are going to learn a lot from him. So at this point, I want to ask you to keep your questions coming in, your comments. We're here to listen to them, and then, hear what you have to say. Before I go on, I want to show you a clip that comes from Kumasi. And when we got this, it was quite worrying. We got this clip last week. Now this is KJTR market in Kumasi, which was only taken last week. And as you can see, it's business as usual. No masks, no social distancing. It's just like you'd find on a normal market day in normal times. But as we know, this is not normal. We are in COVID-19 times, and behavior like this is just not going to help us. So the question we're asking is, what role is the media playing? How can the media help us, in the fight against COVID-19? And at this point, I'd want to bring Dr. Nikoi to tell us about or give us a sense of the narrative of COVID-19 in Ghana. So, Ni, welcome to the Health Info Africa show. Can you share a few words with our viewers before we go on to the main discussion? Tell us a bit about yourself.
Thank you, Brafusa. My schoolmate. Essentially, thank you so much for this platform. Apparently, my rantings on social media have yielded some good, in a sense, to have the opportunity to speak to your viewers today. I am a graphic designer, photographer, and media researcher by training and hobby as well. I'm an avid media junkie. I teach global media and digital studies. My main interests are how media shapes the way we think about a myriad of issues from race, class, gender to sexuality and so on. So I'm really interested in the way the media kind of shapes our outlook on society, right? How it shapes the way we think about problems and the solutions to address those problems. So those are my preliminary comments.
All right. Thank you very much, Nee. And before we go on to the main discussion, can you give us a sense of the media?
Of the media landscape. Okay.
Yes.
So essentially, I mean, often people are critical of media, right? Especially Ghanaian media, and it's always instructive to kind of have an understanding of how the kind of the challenges and the constraints of Ghanaian media, right? To understand the context in which journalists do their work, right? So about a third of media in Ghana is controlled by political parties or politically affiliated groups. Journalists are poorly paid and overworked. They deal with a lot of political fear and intimidation. There are very few investigative journalists. Independent media outlets are few and far between and very limited. There's also the financial impact of COVID-19 on their work as well, right? So some journalists have had to do part-time work. Some people have been laid off. So the media houses are also kind of struggling under the constraint of COVID-19 as well. Then you also have just the way the media are trained and the way they work, right? That's the way journalists work, right? There are certain media conventions that often lend themselves to spreading misinformation. And for example, right, you have one of the biggest debates in the world that was happening around climate change, right? And you had climate deniers given the same amount of space and airtime as scientific consensus that climate change was real and it was impending, right? And so questions of false balance, right? Here, two sides of the story as if they both carry equal weight. So there are conventions that also kind of shape media work. The he said, she said journalism, right? Interview party A, they share their opinion. Interview party B, they share their opinion, and then viewers are told to then discern who is telling the truth, right?
So that's quite worrying then. So in a sense, the media, it appears there's not really a critical, analysis, critical discussion. It turns out to be just putting out information. Is that what you're,
Well, for the most part, we see that often happening, right? But there's also some critical engagement. We're trying to verify with whether what people are saying is actually true, right? So we've seen a shift, and one of the areas we've seen that is the rising phenomenon of fact checking, which is one way of verifying whether what somebody's saying is true or not, right? But the problem we have with fact checking now is that it tends to be arbitrary, right? So not everything is fact checked. What gets fact checked varies. And we can attribute that to the work constraints on journalists and so on, right? So it's a myriad of factors. But I think that the point I want to make is that there are also journalistic conventions that also are inimical, right, to fighting misinformation, fighting disinformation, and really challenging official dominant narratives that do not allow us to combat, COVID-19 aggressively.
So let me just go back to what you said. You said about a third of the media houses in Ghana are affiliated to the government or other political. So how does this then help us put out the right, because that is quite a number of talking about a third. It's a really large fraction, and to have such a platform doing the bidding of politicians, it's quite worrying. And I'm gonna be frank out here and say this. The conversation surrounding COVID-19 has been affected badly by politicians and their rhetoric. And this is, worldwide. We saw what happened over here. We know the cases in the United States. Look at what happened in Brazil. Look at what happened and even what's going on. It's terrible then. I mean, if this is really the case.
Right, right, and so that is very true, right? If you have, and it's true for many societies where the elites, political affiliated business interest control, a chunk of the media, right? And so that's why independent media is important as well. But more to the point is, even though politicians, own or are affiliated to media houses or have shares in media houses, doesn't necessarily mean that the media houses always do their bidding, right? And so sometimes, you have interesting stories that push back against, the interest of the owners and so on. So it's not always that cut and dry, right? But then it does have implications. It does affect coverage, right? Journalists have been outspoken about how they've tried to pursue stories, and they've been told by their owners to stand down, to stop challenging those stories, to stop pushing back, to stop being too critical of the government, to stop being. And so this happens, right? These are documented incidents. Journalists have been talking about it. It's nothing secretive, right?
Yes.
So that definitely impacts it, but it's not cut and dry, right?
Okay,
it's not always guaranteed. Yeah.
So I guess, there are journalists who are doing a fantastic job and who would want to do more, but limitations that they face.
Right.
And I think we should all add our voice to this conversation to help them do their work. I mean, in a way, just encourage them, because the information needs to be put out there. So now back to our conversation. What is the current media narrative of COVID-19 in Ghana? Can you give us a sense?
Right. So I have a few slides. Could you put up the first slide? So essentially what I think was happening in the beginning, right, when we recorded our first two cases, right, the first two cases recorded, the cases started jumping up. There was a lot of media attention. Could we go to the next slide? There was a lot of media attention. And so I did a quick kind of, that's that slide. So I did a quick kind of overview of just looking at City FM, City Online News, not the City FM, the online news portal. And this is a caveat, like most of my observations and commentaries today are just going to be based on my consumption of like English speaking stations that are mainly situated in Accra, because that's where I'm from. Those are the media outlets I'm familiar with. And those are some of the media outlets that drive a lot of public and national discussion on issues. So I just did a quick kind of search of what are the news stories that have been published on coronavirus Ghana on City Online. And you can see from March, April, and May, the significant number of stories that were churned out with COVID-19, right? Remember, we recorded our first cases in March. We had a lockdown in April. The government was communicating a lot to citizens around that time. There were a series of press conferences. So there was a lot of attention on COVID-19, right? And that seemed to be the pattern across many media houses, right? Initial media coverage was phenomenal, right? There was a lot of public education going on. Journalists were on the ground visiting communities, seeing whether they were observing safety protocols. You had this constant wall-to-wall coverage, right? Then you also had media houses creating specialized programs just catered to talking about coronavirus daily and weekly. So City News and City FM, for example, had special COVID-19 coverage. Joy FM had a show called, hosted by Samson Ayeni, called COVID and the Law, right? So they created specialized programs to kind of focus on what was happening with COVID-19. Then you also had, their own practices in studio. So you often see them, observing the safety protocols themselves, right? Masking up in the studio, observing physical distancing and so on. And there was this constant attention and given to the coronavirus and what was happening, right? What was unfolding in Ghana and what was unfolding globally as well. And that kind of factored in almost every kind of event that was covered. So I don't remember, I'm sure a lot of our viewers and listeners will recall the kind of the outrage that ensued when the government wanted to continue doing the registration, the ID card registration, and people were so outraged by that, right? And so scared that they were going to spread the virus. You had journalists visiting, the hospitals, verifying the isolation centers and all that, right? So there was a lot of intense coverage. So that was kind of the initial coverage, right? Now, something happened along the way, right? We started testing less. We started getting fewer confirmed cases. Then the narrative shifted, right? The narrative shifted that we were doing well. And since then, the media coverage hasn't bounced back to the sort of coverage we're experiencing in March, April, May. We haven't gone back to that level of intensity and coverage. And I think it speaks to many things, right? It speaks to many things in terms of how the government's own kind of messaging. Could you go to the next slide, please? The government's own messaging over the period of time has shifted, right? And so we have the State of a Nation addresses where the president will come and speak to the public, right? We've had a series of them, right? And then, press releases, then we had press briefings from the government as updates. Those were coming in regularly as well in the beginning, from March, April, June, thereabout, they were quite regular. Now they are irregular, right? The releasing of data is also kind of irregular as well. So there's something going on with the government, public communication as well. That in turn is also affecting media coverage as well. Because a lot of the time, a lot of stories are also reportage from the government. Like, what is the government saying to the public, right? So if the messages are few and far between, they are less and less, they are irregular, it kind of also then has an impact on the way, COVID is communicated to the public.
Yeah, so with this, then it's I think it's a very worrying, development, because look at what COVID is doing around of COVID-19. Cases have ballooned everywhere. We are having, hundreds of thousands of cases, new cases every day. The number of people dying daily. We should be in a situation where coverage should go back up, even beyond what we're having in March, and to May, because now we know more about COVID-19. There's a lot more information that should be out there. We should be talking about vaccines. There are so many conspiracy theories on vaccines. We should be clearing the air. So I think it's one. Before we go on, I'd want to play a short interview that we had somebody in Kumasi again do for us. And this,
Madam, so then I watch for COVID.
I ain't the mingin this oh.
Ungin this oh. I didn't know ungin this oh.
Cause me who she.
Then I person
Then I person me who.
Then I person. Bibi sense I person go.
Cause me probably know what's so man and me who she.
So there you have it. I mean, and this is not an isolated case. The best we had was somebody who was saying, yeah, he was aware, he believed it existed, but he thinks it's no longer there. But what she was essentially saying was that she doesn't believe that COVID-19 exists. She hasn't seen anything. The people she lives with, they are there. I mean, she hasn't seen anything. And right. we should be putting the information out there. We should be putting the information out there. So, I mean, you've talked about how everything has reduced. I mean, you've taken us through the process. Now, what can we do to have this, bounce back? Right. Are there media houses covering COVID-19 now? What are they talking about? How can we improve the coverage?
Right. Could you go back to? Could you move to the next slide? I want to just briefly kind of highlight, the intimate relationship between what the government is doing and how the media coverage kind of plays out, just from these cursory observations. So this is just a quick graph that I did, trying to look at the days in between when the president gives his speeches. And you can see the longest interval, right, between the speeches kind of happens between 8th and 20th, 8th November between 20th. That's almost like 46 days, right? And so you see a decline in the regularity of speeches. You see longer days in between speeches. Could you move to the next slide? And I'll show you why, kind of we should think critically about the government coverage, right? What's happening also is, even with the government communication of the information, we realize that there's also some kind of public relations being implemented, right? You often see the Minister of Information kind of talking to the public and giving us a sense of how to understand what's going on. At one point in time, the minister said, we are seeing more cases because we are testing more. But we are seeing more cases because there are more cases in the society, right? It's not simply because we are testing more. And then at one point too, you had the government saying, oh, the cases are imported, And so the government communication has really played a part in this. One way you can also see that is even the way they display their data. So on June 28th, this was the data that was kind of put up on Twitter at the Disease Surveillance Department, put it on their Twitter handle. And you can see how even the sizes of the numbers and the confirmed cases and all those kind of shift over time. So now active cases is the biggest number there, right? And it's when it was a higher number, it was smaller. It's become bigger now. Recovery and discharge has also become a very big number at the bottom. And one of the serious numbers we should be focusing attention to, which is the confirmed cases over time, has become so small, right? So even in the way the information is being communicated, there's a certain approach to attempting to downplay what's going on, right? Could you go to the next slide, please? Right? No, before this. Yes. And so then all this feeds into this narrative of progress, right? This narrative of progress that has had such a sway on what's going on and kind of making people think that we are actually in a post-COVID era where people say, Mihushi, I know they see anything, right? Because the coverage has fallen, from its height in March, April, May. And on top of that, there's this dominant narrative of progress that the government is pushing, where it clearly knows that the only reason our numbers, or for the most part, the reason why our numbers has gone down is that there has been an important change in the way we are testing. There's been an important change in our response. And so and the scientists and the public health experts have been telling us that we don't even understand our situation properly because we just don't know, right? The data isn't there to tell us the extent of spread. We don't know, right? We just have a piece that gives us some insight. But then that piece is not a concrete piece to tell us that we are safe, we are out of the picture, right? And so what the media hasn't been able to do, in my opinion, is to challenge this narrative of progress, right? Even though there are scientists speaking, there are researchers talking, there are public health experts talking and constantly reminding us that we don't know where we are because we are not testing enough. But still, the narrative of progress, we are doing well, cases are on the decline, is still going on. And I think this goes down to people are fatigued, to be honest, right? People really want things to get back to normal, including the media houses themselves, right? They want things to get back to normal. And so we don't want to confront the government's misleading narrative of progress. And that misleading narrative of progress is, in turn, kind of giving people the perception that all is well. But you just randomly test people in Accra, right? Like the seroprevalence study did. Could you go to the next slide, please? Yeah. So just before I touch on the seroprevalence theory, I just want to highlight that in other countries, when the governments were downplaying the virus, the media was bold and loud to call them out. When Trump was saying that, oh, this disease is not that serious, right? The media is being biased, right? The numbers are high because we are testing more. Trump actually used that same rhetoric as well. Boris Johnson was also blatantly lying about the seriousness of the disease and extent of the disease in the UK as well, right? But the media, the researchers came out and boldly challenged the government narrative, and that affected the response going forward, right? Because they challenged the government narrative. Could you go to the next slide? And that's the last one. Yeah. And so there's evidence now. We actually have evidence to show that the government narrative of progress is misleading, right? It is, in fact, if anything, a lie, right? You have a study that shows you that it estimates that about over 1 million people only in Accra and Kaswa, right, were probably infected in the past with COVID-19, right? But our confirmed cases are still below 60,000 or so, right? This is a big, this is a contradiction the media, I feel like, has the ability to grapple with, and they haven't. And they can't do it, right? But I don't know why the consistency and the intense coverage that was happening before isn't happening now, right? And we can chalk it down to a myriad of factors, right? And I know there are excellent journalists who actually know what's going on, right? So there are a myriad of factors we need to figure out. Yeah.
Yeah, that's quite worrying. I mean, the next question that I was going to ask is, and you kind of touched on that a bit. How can we get the media coverage up? I mean, how can we make sure that people know about what is going on? For instance, how much do people know about the new strains? I did a search myself. I don't think I came up with a number of articles that will explain what the consequences that the new strains are bringing to the fight against COVID-19 are. The conspiracy theories circulating about the vaccines. And like you said, I've heard some misinformation on some of the, the radio stations as well. So how can we improve, the coverage of COVID-19 in the media?
Right. I think I want to encourage people to pay attention to programs like this, to follow public health experts on social media, to follow the conversations even journalists who work with mainstream media platforms are having themselves on their platforms, right? Where they are actually talking about even their own experiences of COVID-19. I just saw one journalist talk about how they almost died from COVID-19, right? And how that really affected them seriously, right? You have Gary Al Smith, who did a wonderful job documenting his journey with COVID-19. And then afterwards, talking about the symptoms he suffered, even after he was kind of categorized as recovered, right? The fatigue and so on. So look to independent media outlets as your sources of information first, right? And then start challenging the media narrative as well. Sometimes pressure from the public, pressure from social media can get media houses. It actually gives media and journalists the cover to do stories, right? So if there's any fear or intimidation as the reason for why they're not able to challenge the government narrative, it's actually independent citizen journalists and independent media outlets that can put pressure on them, right? So because if everybody's talking about it and kind of confirming that there's something going on that we are not really grappling with, they have no choice but to pay attention to what people are saying. So that's one way to do it, right? The other way to do it is also to hold them accountable, right? And continuously ask them, how come, our numbers are so low and we are still being bombarded with this narrative of progress about our cases are on the decline and we are doing well, right? We're in a good position. When we know, right, the bars, the chop bars are open, the pubs are open, the beaches are open, the clubs are open, the mass gatherings are up and down, the markets are open, people are not physically distancing. We know the general atmosphere of what's going on the ground really is in sharp contrast to what we are seeing in the numbers. So there's something going on, right? We need a detailed investigative story to really expose what's going on, right? We need whistleblowers at the Ghana Health Service to come out and tell us what's happening with the way they are being told to manage the numbers. We need people to speak up, right? And unfortunately, the public also then has to be a cover to help those who come out and speak out. Oftentimes, people will speak out and risk their personal safety and their lives, and then it becomes one news story, and then we forget about them. And so then they won't come and speak out. Who will come and speak out again if they're going to be abandoned and left on their own? So I guess the point I'm trying to make is we need to figure out what's going on our own. Right. We need to put pressure on the media outlets and the government to honestly start telling the truth. You cannot say it's safe to open schools when scientists are telling you and researchers are telling you that we don't even know where we are because we are actually not testing enough. And so how does that translate to it's safe to open schools? We just held the inauguration in Parliament and the inauguration of the president. Nobody can tell me that, looking at the images in Parliament, even with the sitting arrangement, that they were properly physically distanced. There was very little space in between, the seats, and they had their mask off and things. So that essentially was a super spreader event, right? But if you look at the media coverage, there's barely a conversation about the ramifications of what happened in Parliament with regards to COVID-19 and its spread. And so there's something about even when, at the height of our coverage, COVID-19 seemed to be very central to even how we understood what was going on with events like this, right? Now it's not even, it's only a footnote, right? Somebody will mention it once and we barely gets discussed.
And then you see, I mean, like you said, footnotes, COVID-19 protocols will be observed. It looks like that's the new way of saying item 13 is assured.
Exactly.
Yeah.
Exactly. But then there's no follow through, right? Even though when it's being broken, that we can all see, right? There was no physical distancing between the people sitting in parliament. Nobody could argue that those things were like 6 feet apart. That's not true. And we know that when you are in a room that's poorly ventilated for X number of minutes and everybody's loudly speaking, the dynamics even change on even what the distancing can afford you in terms of being safe from capturing the virus.
Yeah.
Even the people in parliament themselves, right? There was a story that came out that said all parliamentarians had to test for COVID-19 before they would begin their session, right? But then the official protocol is that you only test symptomatic people and then the contacts thereof, right?
Really?
Show up to the hospital. Now, if you think about it, if they are telling the rest of the Ghanaian population that they can only be tested if they are symptomatic and show up to the hospitals, which, by the way, now they have even strict kind of definitions of who to test, and then people have to even pay for the testing themselves, which is not even a big story yet, right?
Mm-hmm.
So there are myriad of issues that are leading to our low case count, which Nana Kofi Kwachi, to be honest, has been aptly telling us for a while now, right?
Yeah.
And so there's information out there, right? But why is the information not sticking? Why is it not challenging the government narrative? Why is it not shifting our attention and seriousness to COVID-19? And it's a myriad of issues, to be honest. It's never one thing.
Okay. So just to inform our viewers, we'll have Nana Kofi Kwachi back with us again next week to give us updates on the COVID-19 numbers, and then we'll see where we've moved since the last time we had him on, which was about a week ago. So before we go on, I want to play another video that again is coming from Ghana. And then in this case, it was a young man who had been to a pharmacy who was being interviewed about COVID-19. Take a listen.
Just like night, we also couldn't also by every I say if you COVID-19, I say ever since you I be 10 me. Upi around she knows Max. Until could also you could do a visual, I say, once Asana, I'm more so now first now you visa. Maybe once I say that you be about I might be able to count your brother.
So do you think that it still exists or it's gone?
My dream is to the moon say, oh, just say, you are doing your India more mindful for so. Almost fair or more kind of miss a woman. I mean, we say, oh, but ye may at young. I quite say, I don't know, you only say in here. I'm saying, the engine you are.
So you hear what he said, and let me just translate for those of our viewers who don't speak Twi. So what this young man was saying was that they were there, they were told that a disease has come, and then we had to observe certain safety protocols. And he clearly said that back, then in March, April, if you didn't have a mask, you wouldn't be allowed in certain places. But now nobody's expecting them to, nobody's really pushing them to observe these safety protocols. So the interviewer then asked him again, do you think COVID-19 exists? And he said, yes, he believes it exists because in other places or in other countries, when he talks to relatives over there, they say, they tell him that the disease is there, but he doesn't think the disease is anymore. It's not in Ghana anymore. Those were his words. It is not here anymore. Because he doesn't hear anything, he doesn't see anything, everything is back to normal. And this is quite worrying. We have new strains circulated and mutations, are going on. Anyway, I think we've had a wonderful discussion. Nee, before you go off, I want you to just give us a sense of how the media is faring with COVID-19 vaccine education.
I've seen the discussions I have mainly seen, and this is just a snippet of what I've seen, is really about whether we're going to get it sooner or later. And so there are many discussions about that and the possibility of getting it. That's what I've seen so far. To be honest, I haven't really focused too much on the conversation, but that's just a snippet I've kind of observed. But I just want to add two things before I leave, which is there is relatively no discussion on post-COVID problems that people are facing actively. And I think we really need to also pay attention to that. It's as simple as going to interview people who have suffered COVID-19 and are facing challenges with fatigue, mental stress, and all that stuff that have been recorded in other countries as well. In fact, as I was listening to BBC, and there was a study from China about how people were still experiencing problems 6 months later with sleep, depression, and fatigue and muscle pain. So it's not like when you get the thing, it's gone, right? And I feel like the way even long COVID hasn't become a serious national conversation is really, really telling of where we are in terms of public discussions of COVID. So thank you so much for having me. Thank you.
And thank you for letting us understand the media, how the media works essentially in Ghana. And I think at this point we all have to try and support our journalists. As they have told us, there are wonderful journalists back in Ghana who want to do beautiful work, but there are so many things that are limiting them. Let us, the citizenry, serve us, what you call it? How do I even put this? A shield for them. When we make the noise, when we talk, they are going to be able to talk because they will feel protected. They know we have their backing. And I think this is the way that things work. And like you rightly said, in the United States, the government deliberately tried to downplay COVID. And it was the media that kept the narrative going.
Right. And brave journalists and
researchers. Yes, they spoke out. They kept the narrative going. And if it hadn't been for that, it would have been worse than what we are seeing right now. Even here, they politicized mask wearing and all that. But let us help our journalists, because there are wonderful ones out there who are trying to do good work. And so I think this has been a very wonderful discussion. Thank you so much.
Thank you for having me. Yeah.
For viewers, Neil will be here to answer your questions. If you have any comments, keep them coming. And at this point, we'd like to go for a short break. And then when we come back, we'll move on to the next discussion.
Spain has surpassed China related to this virus and the outbreak.
It no be one photo, say we dey fight corona. But as we dey take precautions, I get the feeling, say we go overcome 'em.
It no be one photo, say we dey fight corona. As we dey fight, we for pay attention,
Before you sanitizer, one suffer seminar, and regularly drink water.
If you coughing or sneezing, nose masks be the new anthem, my guy. Yes, I wear anthem.
Charlie, social distancing to the end.
Stay home be the best option, mania.
Exercise the body and eat healthy.
And at the end, we for pray to the Almighty.
Corona, I didn't be a banana, but we for take responsibility and keep fighting with positivity. Never fight. Spread calm, not fear.
Hello, listeners. Once again, thank you very much for the great conversation that we've been having concerning COVID coverage in Ghana. We know that the more we speak about these things, the better we will be aware of the disease and what ramifications it has on our people, because we do not know as of now the long-lasting effects of contracting COVID-19. At this point, we're going to switch the gears a little bit and focus about our health, preventative health. Last week or a couple of days ago, we spoke about, what are the things that we have to do in terms of post-COVID or even during COVID. What are some of the ways that we can get health care without, the risk of contracting the virus? And we spoke about what we call telemedicine. And today we are privileged to have a very, 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 I would say, industrious person that I've been working with. Is a nurse practitioner. She focuses on preventative medicine and also currently embarking on promoting telemedicine. I have no other person than our own Eunice Cromwell. I've been working with her on a lot of media platforms to encourage good health amongst our Ghanaian population and everybody that is listening to us at this point. So I'll go ahead and invite her to join us at this point. Hi, Eunice, how are you?
I'm fine, thank you. How are you?
I'm doing great. Welcome to HIA TV, where you have most authentic information. And today we are privileged to have you for this discussion.
Thank you. Thank you.
All right, great. So we're going to be talking about preventative medicine, which is something that needs a lot of attention to keep our bodies moving forward. So before we go forward, I wanted you to tell our listeners about yourself. What do you do? What do you practice? And things like that.
Okay, thank you. I'm very privileged to be here. I've been learning so much from all the discussions that are going on. My name is Eunice Cromwell. I'm a family nurse practitioner by trade. I've been in the healthcare field for about 20 years, so I've had the privilege of working in lots of different capacities. Started off as a nurse, a certified nursing assistant, did the medical assistant. I was an LPN, I was an RN, and then I did my master's and NP, and then I'll be doing my doctorate pretty soon. So very interested in preventative medicine. Currently, I work for the underprivileged and underinsured in the Chicagoland area. I do home visits, and I focus on preventative medicine because preventative medicine is a specialty that allows us to treat things prior to it becoming too much of a problem. So that's my main focus. I prefer to have the notion that prevention is better than cure. And so while we have a lot of people who are working very hard to find medications to treat diseases, I focus more on making us in a way that we won't have those diseases to begin with, so we can be able to live the best life possible.
Great, thank you very much for that introduction. So viewers, that is Eunice Cromwell. She's a woman of many hats, and I've worked with her. She has a lot of great information to give us today. So again, I want you to kind of delve a little bit into what really preventative health or preventative medicine is, and how our Ghanaians will benefit from it if you really embark on it.
Absolutely. So preventative medicine, like I said, is ways that we are looking into having people not have certain diseases. So when you go to the doctor's office yearly for your physical and they check your blood pressure, they assess your cholesterol, we are doing these things to make sure that your numbers are right. So upon doing some research just for our program today, I did see that back in 2011, there was a telemedicine program that was piloted in Ghana, somewhere in the Ashanti region. And it was developed with this pharmaceutical company that's also worldwide. And it started off very well. It was accessible to about 35,000 people. And they were just having people do consultations. So the way their telemedicine model worked is that the people who were in Ghana had a network of physicians and providers here. So if they needed to consult anybody, they could be able to consult just like the way we are talking now. So telemedicine in itself and preventative medicine, because of COVID-19, has really been on the uprise. Because why? We don't want for people to just be coming to the clinic. We don't want for the emergency rooms to be overwhelmed. So we are really more pushing that people are really taking care of all their preventative medicine. So you get your immunizations, you get your testing, right? At the age of 50, you're supposed to be getting a colonoscopy. At the age of 65, you're supposed to be getting a DEXA scan, pneumococcal vaccine. All these things are things that you do to prevent long-term diseases and then make it difficult for the healthcare system in itself. It also wastes a lot of money with your insurance. And it makes you feel bad overall, because a lot of things can be prevented if you were to embark in preventative medicine.
Great. So as we all say, a lot of things can be prevented if you embark on preventative medicine. We've been talking about preventative medicine in Ghana, something that is going to be very critical when it comes to post-COVID, and even during COVID pandemic, a lot of people are not getting the health needs they need in terms of visits to the clinic and things like that. So what are the ways we can help ourselves by, taking good care of ourselves so that we don't get sick? So we have Eunice here talking with us in this on this particular topic. So Eunice, I have a question that when we talk about preventative medicine, a lot of Ghanaians think that is, how do I say, it's like it's for the elite, some of us, we don't really have to go to the doctor. We will go to the pharmacy when we're sick, or go to a traditional medic or something like that. What would you say to such a person who has this notion?
Well, you know what? I've seen that it's actually cheaper to do preventative medicine than to wait till something happens to you. And I think that the mentality in Africa in general is that I'm not going to go to the hospital until you're almost on your deathbed. And that makes it very difficult and also makes it very expensive, considering that also in Africa, we have the cash and carry system where you go to the hospital and you are required to make certain payments. I can recall very well that some of my friends, they were sick in the hospital, and the pharmacist or the doctor came in, wrote down on a piece of paper what they needed, and their family had to go and get that IV medication, go and get all those things before the doctor was able to administer it. So in a situation like this, you'd be better off going to your doctor's office at least once a year or every 6 months, pertaining on what conditions you are dealing with. And in this way, they'll be monitoring you. You can have medications that can prevent you from getting sick and prevent you from having to go into an emergency situation where you won't have the money. So when you think about the economy and you think about the way the system is in Ghana, I think Ghanaians, more than anybody else, needs to practice preventative medicine because it's cheaper in the long run.
Great. So yeah, long run, but we all understand there's a lot of limitations when it comes to our healthcare delivery in Ghana, and how that kind of weaves in. And again, you have the Nunu Foundation that goes to Ghana to kind of give some kind of healthcare to people. And I'd like for you to share a little bit light on that great work that you've been doing in Ghana, if you want, if you'd like to.
Oh, thank you. Yes, so the Jemima Nunu Foundation is a non-for-profit organization. Our focus is empowering others through education, access, and giving. Last year in 2019, I went to Ghana and we were able to do a health fair. We serviced about 500 people for free, providing medications, preventative screenings. That's what I'm always practicing. So we did a lot of blood pressure, a lot of blood sugars. And it was amazing to just really get to know the community. That was in the community of Anamabu. That's where my father is from. And that's why I've been focusing to develop the country in a way, to develop that village in a way that they can be self-sustaining and they can all practice preventative medicine. So I have launched a program. It's a follow-up program. I work very closely with the Anamabu clinic there, and we monitor these patients. So the patients that we put on blood pressure medication, we are checking on them, making sure that they're taking the medicine, checking their blood pressure, making sure that everything is okay and they're not getting any side effects. And I say that it's very important because long-term side effects for not checking your blood pressure is kidney problems. And dialysis, we know, is far and few in Ghana. So just imagine you having to be on dialysis and they can't find a dialysis center and you can't afford it. You can see how much more problems you're going to be causing your family and yourself. Whereas if you would have just had a doctor who was giving you blood pressure medication, you were taking it, and every 6 to 8 months they were monitoring your blood pressure, monitoring different blood levels. Do you see how much easier it would be? So that's why there is a lot of limitations to our healthcare system in Ghana, and I understand it completely. But I think one thing the government can do to focus on is to develop really stricter preventative medicine regulations for the clinics, and also make sure that the providers who are providing this service are getting reimbursed. One big problem that I saw when I was in Ghana is that a lot of clinics and a lot of private practices, they don't get the money back for the insurance. So when you're unable to get money back for the services you provide, you're not able to keep your clinic going. And so it just becomes a vicious cycle, and it shouldn't be like that. We should be able to take our health very serious. In order for us to make our nation and make Ghana a country where people would want to go and settle, we need to very, very look critically at the healthcare system and fix it significantly.
All right, so thank you very much, listeners. Those of you who are tuning right now, please share the feed, put in your comments in the comment section. We'll read them and answer them. Eunice is here to help us with all the knowledge that she has. We are talking about preventative medicine in Ghana and the role that it will play in terms of the health of Ghanaians as such. So going forward, I wanted to ask you, so if you compare the United States or other Western world and in terms of preventative medicine, how do you see it? How does it compare with back home in Ghana?
So I would say that what you said in the beginning was very true. People who have the knowledge, people who have traveled, people who have the money, I think that they have join the idea of how important preventative medicine is. One thing I did when I was in Ghana is I spoke to a lot of different providers and just tried to get an idea of how they practice. And they have the same notion that we all want to have, right? We wish our patients would come in before it gets to be too serious. You know, we wish patients would tell us their symptoms before it becomes something that the emergency room is unable to handle. And I think because of our lack of supplies, quite frankly, Ghana, I mean, it's lacking in a lot of stuff. There are a lot of hospitals you go to where they don't have enough oxygen. They don't have proper IV poles. So when you think about that and how dangerous it can be for anyone, we are far behind. I mean, I would say the United States does very well with preventative medicine. You know, we have the Preventative Task Force, which regulates all the clinics. So people who are here, for instance, if you were to have a baby, you know how when you go to the clinic, they're already telling you that at this age, your child should have this. At this age, your child should have this. They've regulated in such a way that you're unable to enter school, public school systems, without having the proper immunizations. So these are things that a government should implement to make sure that your society is healthy. When you do this, you reduce the risk of mortality, and then everyone lives longer. So as it stands here, according to statistics, I think the life expectancy in Ghana is somewhere around 63 to 65, if I'm not mistaken. That could be a lot longer if preventative medicine was a priority.
Great. So we're talking about preventative medicine right now, and Eunice is giving us some very good information about how the United States compared to Ghana. Do you think, in the US, before your insurance, how much you pay kind of tallies with your age and some predisposing, conditions you might have and things like that? I'm not particularly sure that is the case in Ghana. Do you think it has a role to play with how people take ownership of their health?
Yes. And I really think that the best example I can give with that is people who smoke. So when you smoke cigarettes and you go for health insurance, your health insurance premium immediately goes up. Your life insurance premium, I think, goes up significantly as well. So they use all these things to let people know that the healthier you are, the less that you pay. And that is what I was saying in the beginning, how when you look at the whole picture, preventative medicine and making sure that you're doing those small things to keep yourself healthy, you're helping society in general. The doctors love it because when you come in, there's not so much that they have to do with you. They're just maintaining you. If it's medication you need, they're filling your medication. They're doing patient education. That's perfect. Now you have someone who doesn't want to do anything, someone who has a blood pressure that always ranges between maybe 160 to 180. You've already put this person on medicine. They don't take the medicine. So now you're wasting the pharmacy time. You're wasting important resources. If you're on Medicare or Medicaid, you're wasting tax dollars, right? Because now they're paying for you to have free health insurance and you're not utilizing it well. Then every time you get sick, you go to the emergency room. Emergency room, they have to pay all the people that are there. It costs more in the emergency room to get care than it would in your primary care doctor's office. So eventually the vicious cycle just keeps on going. So insurance companies, what they really, really want is that they want people to take everything seriously. They even give you bonus points. There was a place that I used to work that they used to give you like a Starbucks card if you went and checked your lipids, which is just to check your cholesterol. Or they would give you some type of incentive if you went and did your diabetes check, if your hemoglobin A1C was below 6, or if you were pre-diabetic at one time and you were able to get your A1C down so you're no longer pre-diabetic. They have weight loss programs, if you've seen at different clinics and stuff, where they encourage people, if you're able to walk 10,000 steps and show it on your phone or whatever, they can give you incentives. So the government, along with the insurance companies, are working very hard to make sure that people are staying as healthy as possible. Then we do have unfortunate situations where no matter what you do in terms of preventative medicine, you get sick. But it's better that you've tried everything, you've done everything, and then if anything happens, they're able to help you, versus you just sitting down and not doing anything and wanting your insurance company to pay for it. It's going to be very expensive because it's a waste of everyone's time.
Great. So everyone's time, as she just clearly indicated. So like I said, we're talking about preventative medicine. We're going to switch the gears real quick. But before we do that, we're going to take a little break. And then when we get back, we're going to talk about telemedicine and its role that it's playing when it comes to healthcare delivery, especially in the United States. Eunice is a nurse practitioner, and she's well versed with telemedicine, and then we can discuss how this can benefit Ghanaians. So don't touch that dial. We'll be right back. All right, so welcome back. We're going to switch the gears. Like I mentioned, we're going to talk about telemedicine and how it's playing a major role when it comes to healthcare delivery. So Eunice, I know that you're a nurse practitioner. You've been, during the COVID season, you've kind of switched to telemedicine. Would you want to tell us a little bit about what telemedicine is, please?
Yes, so telemedicine is using technology to be able to see your patients. So as I said in the beginning, when COVID-19 came out and we weren't really sure of everything, and we know how the transmission was, and we wanted to really promote social distancing, it became apparent to us, and I say us as the healthcare system in general, that we needed to limit the amount of people who were showing up at the hospital. So it started off with canceling all non-emergency elective surgeries, right? So if you were someone who was healthy and you just needed like maybe a colonoscopy and it was just routine, they canceled all those. They canceled mammograms. They canceled so many things. And they wanted to just focus on patients who needed things. And so telemedicine, even though it's been around for a long time, it was launched very, very big with COVID-19. I have a patient database of about 220, and we transitioned all of them. Well, maybe a few still needed to be seen because of their conditions, but most of them were transitioned to telemedicine. And it's just like the conversation we're having now. It's a video conference where you check in with your patient every month. You can see the patient let's say if they have something to show you, if they had a swollen arm or whatever. I'm seeing the patient face to face. I have the ability to order x-rays. I have a lab technician that can go to the house. I can do ultrasounds. I have a vast resources that can help people at home, and it protects me and it protects the patient from getting sick. When you're seeing a lot of patients and people do have COVID-19, going from house to house, you put yourself at risk for making your own family sick. And also, these are vulnerable patients. They're 70, 80, 90. I would also be making them sick from whatever I'm carrying around from other people's homes. So the decision was for me to do full-time telemedicine, and I really love it. Apart from having to make sure you're always ready for your patients, it's a lot of benefits. I found that the adherence to hypertension medications and diabetes medications has gone up because they know that I'm going to be calling them and looking at them, and they can show me the bottle. Hey, I've taken this, I've done this. We make sure their medications are filled. So it's been very, very rewarding. And though COVID-19 has exposed so many discrepancies in the healthcare system, I say one positive thing is it's shown us that we can still take care of each other from being far away. And I think that's a beautiful thing.
Awesome. Thank you very much for information. So please send your comments in. We have Royal Black Jesus saying, good job, guys. He also says he likes my background. So keep your comments coming through the Facebook comments. We'll read it. If you have any questions for either of our panelists, we have Eunice, and you also have Nee. I think we love to answer those questions. So currently we are talking about telemedicine and the role that it has to play in Ghana. So let me bring Eunice back. So the next question becomes, especially in Ghana, right? People think that if the doctor doesn't touch me or, feel me, oh, doctor, we don't want to share me, which literally means that this doctor didn't attend to me. What is your experience when it comes to things like that and the perception of the patient?
It is true. We don't think that things are done when you don't touch things. And I will say that if you are having breathing problems, yes, you may need someone to assess your lungs with a stethoscope, but there are many things that go on that no one needs to touch. If you have pink eye, I can look at you through a camera and see that you have pink eye and be able to give you medication. So I think that we have to shift our thinking. If we want to make sure our society stays safe at this time, most importantly is that we need to stay away from each other. We need to really induce social distancing. So I think at this time would be a great time for Ghana to really take telemedicine, really, really serious. You can join with people, and then you have consultation. You have more of a network. So things that you're not familiar with, you can have a group conversation with maybe a cardiologist from London that's going to be able to maybe express to the patient or explain to the patient something that's going on. And then if there's something that they need to go into, if there's some type of testing that they need to have done, then they can show up at the hospital. But getting patient information, talking about family history and going through medication reconciliation doesn't need for you to be face-to-face. So the things that do need to be face-to-face, I 100% promote it. And I know that we have PPE to protect ourselves. You know, they would wear their mask and gown and try to keep themselves as safe as possible. But what if we take all the things that don't require for you to touch a patient and do those things beforehand via telemedicine, so we can reduce the time that you have to be face-to-face with the patient and therefore reducing your risk for getting COVID-19.
Great. So when you mentioned roughly that it will be cheaper to have some form of telemedicine in Ghana?
It will be, but then our only problem would be probably the technology. So
Okay.
I think that's our biggest halt. When I was in Ghana, sometimes, you know, you want to record something live and all of a sudden you don't have internet access. So I think that would be our biggest downfall.
Okay.
You'd have to have a strong connection, right? You'd have to have a good computer program that can withhold all that data being stored, because you could also use this system to send patient information. Right, yes. You could send them stuff about their disease process. It should be compatible where you can be able to order medications and do e-scripting. So it's a huge call, but it's something that I think is very possible. And when I think about the year of return, I think of the way Ghana wants to be. Right, Ghana wants to be this beacon of Africa and bring people there to really develop the country. And they're developing that Wakanda City and Cape Coast. There's no way this can't be on the radar, because now you're going to be dealing with people from different countries that have different diseases, that have different things, and you have to be equipped. Because if everyone gets sick there and people are not able to work there, you go back to class one, where you know, all the things that you wanted to do are not going to work regardless.
All right, so that's interesting to know. So again, we are talking about telemedicine in Ghana, how we're going to be able to foster that, especially in the pandemic. You know, people are now visiting hospitals. A lot of people are sick at home with diabetes and they're not visiting their primary physician. So we are looking at ways to use technology in order to help people in that regard. But then she highlighted that there are certain limitations, especially when it comes to technology, which begs the next question as to who are going to be the target, especially if you bring telemedicine to Ghana. Is it going to be the young folks? Is it going to be the elderly? And what are some of the things that will play out in that regard? So Eunice?
Yes, my target first to me would be the elderly, right? Because the young people can still get up and go, and they have less of a chance to be having comorbidities and diseases that are going to be harder to monitor. So I would say that ideally, I would love to see it for an older person, someone in their 60s or 70s. And because of that technology issue, I would love to see their younger generation be able to set them up on an iPad or an iPhone so they could be able to attend their telehealth visit. But yeah, that would be ideally the right patient for that. And then I would say probably college students when they're on the dorm. It's a lot cheaper for you to just do a telephone visit versus you leaving the university to now go to a clinic or go to a hospital. Because then you have to think about what you're bringing back into the clinic. And when you think about COVID-19 in itself, how we're trying to condense everything. So we want people to really stay where they are. No new germs, no new people. So that is why it's better to just, if you're in your own home with your own germs, and then you're just talking through the computer.
All right. Yeah, that's so true. So true. Great. Okay, so at this point, we're going to wrap up, you know, the questionings and all the great things that we've heard today. It's been a great show so far. We're privileged to have Eunice joining us today. I'm going to bring in my co-host, Kwame, to join us so that we can have, you know, some few other questions. If you have anything, please put it in the comment section and we will read it and answer it. So we've been talking about preventative medicine and the role of telemedicine in Ghana and how we think that can actually foster healthcare delivery in Ghana. We all know that there's that person, that nurse, that doctor that we know that we can pick that phone and call them. But then we actually want to officialize it so that you can use technology either by Skype, some kind of a video teleconference call to a doctor that can diagnose certain diseases. And again, there's some limitation to this. So at this point, I'm going to bring in my co-host, Danielle, to, you know, ask a few questions she has with Eunice, and then we can wrap up the show. I think you're muted.
So that was a wonderful conversation, and thank you so much for coming on to share your views with our listeners and our viewers. There was one thing that you said that I thought was really important, that we should be targeting the older population because they have more comorbidities and long-standing diseases. But my issue is in Ghana, it tends to be the younger folk who are more inclined to use technology. So then there's a need for us to more sensitize them for the use of some of these techniques. And I think this is where we have to have major players coming in, to contribute to this. I don't know if you have anything to add. Are you aware of any media partners or any telecommunication, companies that are contributing to this,
No, not at this time. There's actually a group of physicians that are trying to go to Ghana, and they're trying to set up something like this so they can have like this consultation service. So it's definitely something in the works. But I do agree with you that the younger people use technology. And so because the younger people use technology, we need more of them to be employed in these type of things, and they should be able to teach their community. So when I think about this in a whole, people in the city have access to get around. So I think about the people who are in the village, and I always tell Dr. Afori this, even when COVID came out, my biggest concern was, oh my God, what about all those poor people in the village? Like who don't have access to anything. And being that my foundation is in the village, and being that I've seen the limitations firsthand, and I was working at the clinic there, that is where my heart goes out to. So even if you were to set up a system where you had a good computer in that clinic itself and people came in, it'd be less interaction of the staff. You could have more people staying at home. And even if you only had 2 nurses and the pharmacist there, it would still help. So I definitely agree with you. And it's definitely a lot of moving parts, but Ghana should try to start doing something. I really enjoyed what he said about the media. We need more people to talk about it. We need more people to have people invest in it. There's a lot of people who have money that want to do something. And this is something that will help all of us in the long run.
Yeah, that's true. And thank you very much. So I think we've gotten to a point where we really need to promote telemedicine, and then we're going to have you on again, and we're going to have Pius, Dr. Sando, who was on last week. He has actually started another telemedicine company in Ghana, and would want to have both of you together and then tell us, about what you have done so far, and again, where you see this going, and just to get people to sign on to the use of telemedicine, because it appears to be the future of medical practice.
Absolutely.
Yeah. Thank you.
All right, great. So so now we do have Neon here, with our final words. We're gonna give each one of our guests today to give their final words. So Nee, over to you.
I just wanted to say thank you for the platform, and this is really where a lot of pressure needs to be put upon not just media outlets but also the government to shift the narrative. And so more attention to independent media outlets. Emmanuel Dogbevi is one wonderful journalist that does deep investigative work that barely gets a lot of attention, but it's so important. And so more of that work needs to get attention, and also independent, citizen journalism, right? Just like the way you folks got people to shoot videos in Kumasi to tell us what's going on, right? That sort of work will be vital for us to push back against this false narrative of progress that the government is using to kind of downplay COVID-19 and also, serve as pressure for whistleblowers within the state and government institutions to come out and tell us what's going on. Thank you.
All right, so thank you very much for that. We do have Hannah Nunu says, great job, Eunice, very informative. As we're wrapping up the show, we will bring back Eunice if she's here to give us her last few words before we wrap up the show. So Eunice, if you're over there, please take it away.
Thank you. I'd just like to take this opportunity to once again thank you for inviting me on your platform. Very informative, very knowledgeable show. I really enjoyed all parts of it. And I would just encourage all of us to do the small that we can. Sometimes when we look at an issue, something like telemedicine or preventative medicine, we think about it in Ghana, we think that it's too big. and we don't even want to attempt, but everybody can play a role in doing something. You can do this by just even going on your Facebook and going live and maybe discussing a topic, talking to different people. So I just encourage everyone to do something, because Ghana is our home. The United States is our home. We want to make sure that everyone is nice, healthy, and safe. And we can't do that if we don't really put some different things into place. So I'm happy, I'm grateful, and let's just continue to do social distancing, take COVID-19 very seriously. It's really on the rise. Those of you who have the opportunity to get the vaccine, please vaccinate. Please encourage your family and your friends to vaccinate as well. Thank you.
All right. Thank you very much for that. And again, we do have Seto who says, well said, Dr. Kote. So yes, please keep your comments coming and we will go back, and if there's any questions, we'll answer them. So at this point, I'm gonna invite my co-host Daniela Fosa to wrap up the show and kind of recap on some of the things that we discussed today.
Yeah, so thank you, and thank you to all our panelists. It's been a wonderful show today. We've learned a lot. I myself have learned a lot. I've understood how the media, I have a sense of how the media operates in Ghana and why it appears that coverage of COVID-19 is down and all that. But I just want to reiterate what Eunice just said. COVID-19 is around. COVID-19 is real. It's wreaking a lot of damage. Take this into perspective. 4,000 people died yesterday in the United States alone. 1,300 people died in the UK alone. South Africa, it's also ravaging them. We may not be seeing the numbers in Ghana, but Nana Kofi-Kwache said this last week, we do not have all the data. It appears we do not have all the data. So you may be seeing that there are a few deaths and all that, but that may not be the true picture. When you go on social media, you hear so many anecdotes about people losing family members and all that. You go and check the statistics. It doesn't seem to be adding up. So please, even though you are hearing numbers that are good and all that, protect yourself. And Nana Kofi even talked about this last week. There's long COVID. There are people who have had COVID and are experiencing long-term symptoms, tiredness, fatigue. It's something we should all be taking very seriously.
Correct.
Please take COVID-19 seriously. Observe the precautions, and then the vaccines. We do not know when we're going to get vaccines in Ghana, but when you get the chance, take it. Edward has been lucky, has taken a shot. I'm hoping that I get my chance soon, and I'm not going to miss it. I'm just going to jump in and take it. So yeah, that's what I have to say. Thank you, and then we hope you join us next week.
All right. Thank you, everyone, for joining us today for the show. It's been very, very informative, and please like the feed and share it. We do have other videos on our network, on Health Info Africa on Facebook, Twitter, Instagram, on all the social media platforms. Please go there and like our feed. And even on YouTube, we do have this live feed also there. You can always catch us on there. So until we meet next week, what I'm going to say is that make sure that you get the right information, healthcare information from the right place, which is Health Info Africa. We also have other collaborators like Trend Africa TV, and we do propagate a lot of information that is very authentic instead of all these conspiracy theories that people are peddling. We would like for you to tune in next week, Saturday, 1 o'clock East Central Time, 2 o'clock Eastern Time, and of course 7 o'clock in Ghana time, so that you will hear us, talk about health and what we can do to prevent disease. So until we meet next week, I'll say from the studios of Health Info Africa, bye-bye and take care of yourself.